don't you prepare more for the task? You cannot pass the task since you are in a past mood these days. You didn't sleep well. How can you finish the task? Why don't you prepare more for the task? You can never pass because the task is so difficult.
She's so stupid.
We know all about you. You're worthless. You're gonna fail your exam.
We hate you. We hate you.
We know all about you, Janice. And we hate you.
Imagine having to battle invisible phantoms that command you to be violent to yourself and to the family you love. Welcome to the world of schizophrenia. Schizophrenia is a highly complex disorder that affects around 0.2 to 1.5% of the world population and is often confused with split personality disorder, creating a lot of misconception about what living with schizophrenia is really like. They may see or hear things that don't exist. Schizophrenia is largely genetic, although stress-inducing environmental factors such as early loss of parents and complications during birth can also have an impact. Each person suffering or recovering from schizophrenia experiences the illness differently. Hi Janice, how are you doing today?
The sky's so blue. They're calling for me. Don't come close to me. Please don't hurt me.
She tried to cut herself today, and that's why we brought her here.
And how long have you observed such a behavior?
Just around, I think, 6 months ago, when she started studying for her A-level exams.
And is she experiencing any depression or other general mood disorders?
I don't think so. It just seemed to be getting worse from the time that it started. I thought it would go away, but it just became more like talking about how people are following her and about how she's seeing signs that are calling to her.
Schizophrenia is a psychotic disorder characterized by many unusual behaviors, including delusions and hallucinations, disorganized speech and behavior, and inappropriate emotions. Symptoms of schizophrenia are usually characterized as positive, negative, or disorganized. Positive symptoms are more active manifestations of abnormal behavior, often seen as an excess or distortion of normal behavior, such as hallucinations and delusions. Hallucinations are experiences of sensory events without any input from the surrounding environment. Janice was suffering from visual and auditory hallucinations, but they can involve all 5 senses. Delusions are beliefs that would be seen by most members of the society as a misrepresentation of reality. The 2 types of delusions often experienced by schizophrenic patients are delusions of grandeur and delusions of persecution. Negative symptoms usually indicate the absence or insufficiency of normal behavior. They include apathy, poverty or thought or speech, and emotional and social withdrawal. There are 4 types of negative symptoms. Avoliation, inability to initiate and persist in activities. Alogia, the relative absence of speech. Anhedonia, the lack of pleasure or interest in anything. And affective flattening, where they do not display any kinds of emotions at all. Disorganized symptoms are characterized by erratic behavior, including disorganized speech and inappropriate affect. Patients may either be speaking random, illogical phrases or express emotions that don't fit the situation, such as laughing at a funeral. There are in general 5 subtypes of disorganized symptoms: paranoid type, disorganized type, catatonic type, undifferentiated type, and residual type. However, these subtypes are no longer included in the new DSM-5 because patients can shift between these subtypes as the disorder progresses. For a patient to be diagnosed with schizophrenia, they have to show 2 or more of the following: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. In Janice's case, we see several symptoms: hallucinations and delusions, and disorganized speech. It is also not uncommon for schizophrenia to occur in late adolescence or adulthood, although childhood schizophrenia does exist. From the looks of it, Janice meets all the criteria for schizophrenia. 2 changes were made to the primary symptom criteria for schizophrenia. The first change is elimination of the special attribution of bizarre delusions and Schneiderian first-rank auditory hallucinations. The second change was a requirement for a person to now have at least one of 3 positive symptoms of schizophrenia, including hallucinations, delusions, and disorganized speech. The APA believes that this will help increase the reliability of a schizophrenic diagnosis. I suspect that Janice may have schizophrenia. Do you know if your family has history of this disorder?
I'm not sure. I don't think so. But if this matters at all, there were some complications when I gave birth to Janice. And her father died early on, and our economic situation isn't very good. As a single parent, I don't really have time to take care of her all the time.
Well, the causes of schizophrenia are not known. However, it is usually an interaction between genetics, neurobiology, psychological, and environmental influences. Genes are responsible for making some individuals vulnerable to schizophrenia. Studies have shown that individuals with family members diagnosed with schizophrenia are more likely to develop this disorder as well. There are a few neurochemical explanations, one pointing towards a highly active dopamine system, the other suggesting a deficit of glutamate in people with schizophrenic symptoms. Some patients diagnosed with schizophrenia are also often found to have enlarged ventricles in the brain. Some findings show that hypofrontality, or the condition where the frontal lobes of the brain are less active, or hyperfrontality, which is when there is too much activity, is more common in people with schizophrenia than in people without the disorder. Lastly, prenatal and perinatal influences, such as fetal exposure to viral infection or pregnancy complications, like in Janice's case, may all have an effect. Psychological and social influences like stress and the quality of family interactions can influence not only the initial development of the disorder, but also the chances for relapse. However, most of these explanations are still being debated. To conclude, there is no one causal explanation for schizophrenia. So Janice, I'll be prescribing you with some antipsychotic medication, and I want you to make sure to take these 3 times each day. Now you may experience some side effects such as blurred vision, grogginess, or dryness of mouth, but be reassured that these are all normal. However, if you're experiencing any more severe symptoms and they interrupt with your daily functioning, then I would like you to come back and see me. Treating schizophrenia is a battle in itself. While neuroleptic drugs are very effective in reducing symptoms, psychosocial treatments are usually carried out to reduce relapse, encourage compliance in consuming the drugs, as well as compensate for significant skill deficits. Compliance is an especially worrying issue, as a majority stop taking the medication after a period of time. Several treatment options are used. One is by using the transcranial magnetic system. This involves using wired coils to repeatedly generate magnetic fields to the brain to stimulate the area of the brain involved in hallucinations. However, this technique is relatively new and will need more research to assess the true value of this treatment. Another is behavioral family therapy. People with schizophrenia are often discharged from the hospital into the care of their families. Therefore, it is important that family members know as much as possible about the disease. With the help of a therapist, family members can learn coping strategies and problem-solving skills. In this way, the family can help make sure that their loved one sticks with treatment and stays on his or her medication. Cognitive behavioral therapy is also commonly used to help them control the symptoms and get them to stay on medication. The therapist teaches people with schizophrenia how to test the reality of their thoughts and perceptions, how to not listen to their voices, and how to manage their symptoms overall. Cognitive behavioral therapy can help reduce the severity of symptoms and reduce the risk of relapse. The prognosis for schizophrenia is one of the worst out of all the mental disorders. People suffering or recovering from schizophrenia often never fully recover, will often relapse and have a high risk of suicide. We hope that these measures can help Janice maintain her important relationships and allow her to live a relatively normal life.
Don't come close to me. I can't see you.